Another thing I want to talk about here before we get into the live Q&A is one good thing about Doge and everybody and Musk and everybody taking over Social Security Administration is they're finally proving all of the BS that it was BS. You've heard about the deep state for decades. The deep state is in there. So this is a Social Security version. So Elon is the captain now of Social Security, and the deep state. The deep state supposedly was in Social Security, and it controlled your benefits, and it punished political opponents. So if you were negative or about this, that, or the other, then you got less Social Security check. There's all kinds of conspiracy theories out there. This whole conspiracy theory about people, paying dead people, no proof there, right? And supposedly, oh yeah, it's not actually paying dead people. It's that money is going to the deep state, and they're not actually paying illegal aliens, undocumented immigrants. That money was actually going to the deep state, and Social Security numbers are, cradle to grave, tracking you, and all of this deep state BS that they've been talking about for decades to distract us from the real issues that need to be addressed with Social Security. There are real issues. There is fraud, waste, and abuse. Usually it's, one-on-one, somebody that's, disabled that are actually working, or, it's not sexy. It's not millions of people. There are, people that are, there is fraud, waste, and abuse out there. But all of this, deep state conspiracy, if there is a deep state, okay. I just looked on the Doge website today, and I didn't see, billions of dollars saved by, stopping money to illegals. I didn't see $1 billion saved by stopping, money to, the people that are dead. So either it was all BS, or the new deep state, Doge and Elon Musk or whoever, is taking that money. And so it has to be one or the other. You can't have it both ways. So that's so again, it's all BS. It's just, we're getting rid of all of the conspiracy theories that politicians have used for decades to distract us from the real issues. Social Security needs to be addressed. The computer system needs to be updated. Social Security has begged for decades for that. We need to worry about the trust fund in the future, because the rich don't pay the same amount of FICA tax as the rest, and so therefore we're going to have issues. We're going to have cuts in the future. So we can finally focus on the real issues. So unless we decide not to. Okay, let's get into some actual questions here. And because there's so many exceptions, and people are really worried about everything with Social Security, and rightly so. Remember, the live Q&A is sponsored by Chapter Medicare. So if you need help with all things Medicare supplements, Part D, Medicare. This is also the OAP. We've only got a few more days. So if you have a Medicare Advantage and you want to switch it to another Medicare Advantage, you forgot to check it, you lost your doctor, you want to see if you're in the best one, you have a few more days to do that, because you can do that January, February, and March, and you can switch from one Medicare Advantage to another. And until March 31st, you can also go back to original Medicare, leave your Medicare Advantage plan, go back to original Medicare, and get a Medicare supplement plan. In most states, you'll probably have to go through health underwriting, though. But yeah, reach out to Chapter and they can help you out. You've only got a few more days. After that, then it's just basically, if you move, or, there are special enrollment periods throughout the year that if you need help, you can reach out to them. Combat action veteran, United States Marine Corps, Serrano, hoorah, old Marine Corps sergeant here, hoorah. My wife is receiving SSDI and an offset with California Corrections for 8 years and did not pay Social Security. Is she eligible on receiving WEP or GPO? Okay, so if your wife is receiving SSDI, Social Security Disability Insurance, and she's been WEP'd on her own record, yes. So what has happened up until now, before the Social Security Fairness Act, she her benefit amount was not, she was not given extra money. Now she will be given extra money. That's the Social Security Fairness Act. No, the other 97% won't be given the extra money, but she will. Anyway, so that's the law. Anyway, So yeah, she hopefully they're supposed to be doing these things automatically. If she's currently receiving Social Security benefits, her PIA, her primary insurance amount, her benefit amount will be unwept. So she should be getting a letter, and the Social Security Administration is doing those now. And they said give them till April to make all the calculations. Um, so I'd keep an eye on that, and they're supposed to do it retroactively back to January of 2024. So keep an eye on that. If she doesn't see an increase within the next few weeks, then reach out to Social Security, and they should be able to help you out. Worse ever. 62, receiving deceased spousal benefits on the spouse record. Recently approved for SSDI. Spousal benefits canceled. They say I can't get both. Live in Florida, not working. Okay. So you can get both, but it really depends on the benefit amount. So possibly your SSDI benefits were higher. So yeah, but you can get both. So let's say if you were receiving Social Security disability insurance and it was $1,000 a month, and then you turn 60, that's as soon as you can collect surviving spouse benefits, and you're entitled to 1,500 from surviving spouse, a deceased spouse. So you'll continue to get your $1,000 plus you'll get an extra 500. And you're like, Ed, you said 1,500. No, you don't get both. You get the higher, but your disability, you get the $1,000 from disability, and then you get 500 for a total of 1,500. So, but in your case, the benefits on your own record are probably more. That's why, so, and it benefits you anyway because you're 62 and because you're approved for disability benefits. Now your Medicare is going to start earlier too. If you would have stayed on surviving spouse benefits, your Medicare wouldn't start till 65. But now you're going to start your Medicare about a year early, which is a beautiful thing. Well, it might even earlier because it depends when they started your disability insurance. If your month of entitlement for your disability, you have to be on disability for 2 years, 24 months. So once you're on disability for 24 months, then your Medicare will start. So if they determine you became disabled 2 years ago, then guess what? Your Medicare started. You'll probably get your Medicare card in the mail here in a few days. So, and then you have to find, something to cover all those gaps. A Medicare supplement with if you're on disability, you probably can't get a supplement, unfortunately, in Florida. I don't think you can. So you might have to go the Medicare Advantage route, which is fine, but it just takes a lot more effort. So, but nothing has been made official yet. All this is smoking mirrors. Smoke. Never heard of smoking mirrors. You mean smoke and mirrors? Yeah, no, it has been finalized. The thing about that you have to go down to the local Social Security office, that starts March 31st. Yep, it all has been final. It has been finalized. Julie, what's up, Julie? Appointment Monday, March 24th for my daughter to get disabled adult child on my SSDI in Florida. I went back to my maiden name, so our last name different. She is on SSI now, paperwork needed, trying to prepare. Yeah, no problem. You changed your name at the Social Security Administration, hopefully. You did your name change, but no problem. As part of the claim, they can update your Social Security card. That's no big deal. No, if your daughter to get the disabled adult child benefits, you're on SSDI. So if you have a disabled daughter, then your child's disability began before the age of 22. Then yes, but they will have to go through the whole rigmarole you did on getting her disability claim approved, and it's going to be so much worse because there's no staff there. So we filed for Social Security right after Trump won the second election. Didn't trust him at all. I'm getting that a lot. Is people are asking me, I was going to wait until my full retirement age. I was going to wait until 70-year-old, until I was 70 to collect benefits. And that's your own decision of when you want to start your benefits, based on your age and whether you're working and you need the money and all that kind of stuff. But there's even before Trump or Biden or anybody, they're all at fault. Social Security, the politicians over the last 20 or 30 years did not solve the issue of the inevitable cuts to Social Security that are going to be happening in a few years, 21, 22% cuts. And politicians need to do that. Even before the current chaos, politicians failed us to address the long-term, solvency of Social Security. And I want to make sure I'm clear with all the new people watching here. Social Security is still going to be around, and unless it's privatized. This is what they're trying to do now, is privatize it, give it complete love to Wall Street. But if Social Security continues to exist, then it will always exist, because people are always going to work, unless there's another zombie apocalypse and we're all wiped out. But anyway, people are continue to work, and they're continue to pay FICA taxes, and that's not the issue. So they pay FICA taxes, but the problem is, it's not population. It's the fact that so much money is exempt from paying into FICA, because all the money is going to the top, and not to us regular people. So X amount of money comes in from FICA taxes, but the problem is X goes out. And right now, that gap is being addressed by the trust fund. Money is taken out of the trust fund every month to fill that gap. And that trust fund is slowly being depleted. And when it's depleted, there's nothing to fill the gap. So this much comes in, that much needs to go out, but it can't. So this much goes out. So everybody gets a 20, 22, 23, 20, 30% cut. So that's, politicians failed us, and they should have fixed this years ago. But we were too distracted with conspiracy theories and deep state and illegals and dead people getting, 200-year-old people. So yeah, we fell for it, and we're going to pay for it. All right. We are over an hour, and there's tons of questions, and unfortunately we're running out of time. I'll be back again tomorrow, come up with another topic of the day, and answer as many questions as I possibly can tomorrow. Y'all take care. Please take care of each other, and please look out for those people, in your community that can't jump through these hoops. If you're able, if you're like, oh yeah, this is no big deal for me, I can do it online. I can go down to the office. I've got perfect, awesome, great. Let's look out for those people that are vulnerable in our communities, the elderly, the disabled, children, stuff like. Let's go out there and make sure they can jump through those hoops. Help them jump through those hoops. All right, y'all take care. Have an awesome night.